have Dr. Paul Moore with us. He's a cardiologist and a wonderful one, and we're going to talk about something you and I love, and that is, how do you stay healthy? What do you do to take care of these problems if you have them, and what do you do to prevent getting them? What's the best you can do?
Yeah, that's a great question, a very, very important question. We in cardiology, it's our job to teach people how to stay healthy. It's not our job just to do procedures or to do imaging or to take care of heart attacks, but it's very, very critically important for us to teach people how to avoid heart attacks and to avoid heart disease. Some of the main things that we can do, everybody's familiar with: watch your blood pressure, control your blood pressure, watch your eating, control your weight, control consumption of animal fat, focus more on plant protein consumption rather than animal protein consumption. Most people can't tolerate or would not tolerate a pure plant-based diet, although that's not a bad idea. But consuming less in the way of animal products is probably a very good thing. It's been known for many, many years that diets that are high in red meat, for instance, are more risky. So in terms of what we can do to help people stay healthy, exercise is critical. Exercise is one of the most important things that we can do. It lowers blood pressure, it lowers cholesterol, and it improves the suppleness or the ability of the blood vessels to maintain that blood pressure control. So the exercise is critically important, diet is critically important, and working in a very active partnership with your physician or your practitioner, whether it's a primary care physician, nurse practitioner, cardiologist. You have to work with that person to teach, to get on the right path. My advice to patients is to get the care that you need from your primary care physician in a timely fashion.
What about diets that, I'm trying to think of things that we can do that are preventative too. Now, what about salt? What about alcohol? What some of the common questions? Do I cut back on salt? What about, some people say a drink or two is good for you, others say no. Absolutely, I don't think we touched on it while we were talking, but it's just smoking is an absolute no.
Yeah, smoking, nicotine should be avoided under all circumstances. Coffee is not a problem. A lot of people worry about coffee and caffeine. Unless your coffee or caffeine intake is excessive, it's usually not a problem.
Okay.
Alcohol in moderation is probably okay. There have been mixed studies about that. Some people are very susceptible to alcohol. One drink of alcohol can put some people into atrial fibrillation. So if you have atrial fibrillation, you must avoid alcohol or maybe even stop it altogether. There are different, of course, heart disease circumstances. Blockages in the arteries may or may not be that adversely affected by alcohol. But I never prescribe alcohol for obvious reasons.
Right.
And I always tell people to, if they drink alcohol, to drink only in moderation. It raises blood pressure. It increases your caloric intake. So alcohol is to be avoided. Salt is to be avoided. The average American diet includes a tremendous amount of salt, and so that raises blood pressure, and it ultimately is a great predisposing factor to the development of congestive heart failure and chronic kidney disease, strokes, that sort of thing. So lower the salt consumption, lower the intake of processed foods, and absolutely avoid nicotine in any form.
Thank you so much, because this is the muscle that makes everything else work.
That's right.
So we appreciate so much you coming in. And folks, I hope you've really paid close attention, because all of this advice that Dr. Moore is giving to you is for you. He doesn't want to have to see you when it's too late. He wants you to take good care of yourself, and your health is your responsibility. So do a good job with it. And thank you, Dr. Moore. We'll be right back.